going to hear from our panelists, starting with Ms. Bennett. Temi, could you talk to us and discuss innovation at your work at the IF Foundation? I understand that you will have several focus areas such as building community power, culture, and reparations and economic justice. Could you share a bit more?
Sure. Actually, these new pillars are new to our strategic plan that we just did. It's a new 10-year strategic plan. And we believe we've also shifted from a racial equity lens to a racial justice lens. We believe that justice is different from equity, and justice requires acknowledgement of past harms in order to heal. And so for our pillars, we have healing justice, we have community power. We've shifted our entire grant making portfolio to participatory grant making, where the community actually decides where the money goes. And then also the government work is under our systems change work. And then this is the first time the foundation has ever took a public stance on reparations. We believe that reparations are owed to African Americans in this country. And then economic justice, we're doing a guaranteed income pilot right now for the region. And I think that was all. Culture. We also have a cultural portfolio where we're doing a 2D animation on the wealth gap in this country. So those are all of like the 5 pillars, and then we all do it through a racial equity lens. And racial justice lens.
And thank you for that distinction, looking at the difference between racial equity and racial justice, building community power, prioritizing the voices who are most impacted. Could you talk a little bit about how collaboration with government partners play a role in the foundation's work?
Yes, so we have basically an inside-outside strategy when it comes to working with government. We have government partners such as yourself and other agencies we work with. Things that we do with our government partners is fund racial equity trainings. We funded the participation of government employees in Leadership Montgomery's racial equity certification program that actually are working with you right now, Dr. Hewitt, on a project. We've funded the development of a RIA for the Department of Energy, DOEE, for their sustainability plan. And we've also we've convened a community of practice where we're supporting all the chief equity officers in the region with our government leaders in action table, trying to support them so they can be sustained in the work, because a lot of time there is burnout in this work, and also looking at what kind of policies and support they can use. So we actually have a consultant that we've hired to actually be kind of like a part-time FTE for them. I'm trying to think other ways that we partner with government. We fund studies for them in partnership just to ensure that like everything is evidence-based. We believe all the work should be evidence-based. And then when the outside strategy is funding the coalitions and the advocates to hold government accountable for these promises and implementing the policies in a way that will benefit the BIPOC communities in this region.
Thank you.
Yeah.
And Temi, I know I thanked you privately but not publicly for the support of the IF Foundation convening chief equity officers across the region. I often say that government work on racial equity is necessary but not sufficient, and that we must partner with folks like yourself and community-based organizations. Mm-hmm. So with that, I would like to shift our questions to our government representatives here. The 3 agencies that we have are 3 of the 12 agencies that are part of DC's inaugural racial equity pilot cohort. And these agencies across district government have volunteered to undergo an internal evaluation of existing policies and practices on racial equity. And I'd like to ask each of our government panelists to discuss what motivated your department's leadership to participate in the racial equity pilot cohort. I will start with Commissioner Woods.
Thank you, Dr. Hewitt, and good afternoon to everyone. Hopefully you can hear me clearly. I am joining you all virtually. Thank you for that question, Dr. Hewitt, and thank you for the opportunity to be a part of the racial equity cohort. In October of 2020, the department formally launched a diversity, equity, and inclusion initiative following a summer of social and civil unrest that was sparked by the murder of George Floyd. And for us, it was very much an inflection point, really thinking about the work that we do and the lens that we apply to the work in the financial services sector as a regulator. And so we learned a lot during our first year of our initiative and began identifying various opportunities for additional support to further strengthen our equity work. And we knew that we would benefit from additional technical assistance and racial equity training from the Office of Racial Equity staff. And so we were pleased to be a part of the initial cohort. I know that there have been a series of conversations that have already been had. And for us, it's important to be in direct communication with our sister agencies. As we began embarking upon this work, we really learned that there were a lot of DC government agencies that were doing amazing work in the equity space. And we wanted to be in communication with them. We wanted to be in partnership with them and learn from them, and also share some of the ideas and best practices that we were engaged in as an agency. And so that really is what sparked our interest in wanting to be a part of the racial equity pilot cohort.
Thank you for that. And you touched on something that I think is important to mention, that even though this office and role is new, government agencies, leaders like yourself, leaders like we have here, there were existing equity and racial equity initiatives. So I definitely come into this role humbly, but also excited about the work and the roadmap that we're on and the agenda setting that we're doing here today. So Captain Hrebenak, I'd like to pose the same question to you. What motivated MPD to join the racial equity pilot cohort?
Yeah, I think racial equity has been a mission since Chief Conti came in. You know, he's been on the department since he was a cadet here in DC, and I think MPD has had a strong history of reaching out to those communities which don't typically have voices, both in DC government, but also within the law enforcement community, right? We had, and the commissioner mentioned the events of last summer with the murder of George Floyd. That really brought to bear the kind of communication, the inequities that existed in law enforcement nationwide. And I think MPD has always been driven to be a leader in that. We started many years ago impacting the community I'm a part of with the Gay and Lesbian Liaison Unit, which reached out to that community that was originally marginalized, especially in law enforcement. And we've worked expanding that special liaison branch, not only for the LGBTQIA community, but also to do other communities. And I think that work kind of blossomed into what we're doing now, and being part of the racial equity cohort. Chief Conti's also worked to start an independent cultural assessment within MPD. And I think it's not only important as an agency to project racial equity, but you need to make sure inside that you are projecting that racial equity. And I think that was an important endeavor by the chief to make the department have racial equity not only externally, not only in our interactions with the citizens and the visitors of the District of Columbia, but also with the people who work inside. Because what you do inside your own agency projects itself out. And this independent cultural assessment, I think, is a good way for MPD to start to take stock of what are the opportunities within our department for advancement of groups of people who don't traditionally have opportunity for advancement into management, and what can we do better in the future. So I think that's a really big part. So all those put together, it was just a perfect fit to become part of this racial equity cohort, and I think it's really important that we be one of the leaders of those 12 agencies that you mentioned.
Thank you, and thank you, Chief Conti, for his leadership as well. Ms. Mauro, I'll pose the same question to you.
So I can answer the question by talking a little bit about the context and background of our department, the Fire and EMS department. We are one of the more diverse big city fire departments in the country. We're about 50% African American, so we reflect the community that we serve. We work on that constantly, though, working on increasing representation, for example, in the Latino and Asian communities has been a focus of ours. So we're quite proud of that. But at the same time, the fire service has a history of systemic discrimination against racial minorities. including our own department. Part of how we got to where we are today was the result of litigation that found discrimination in our recruitment process, for example. So that is a legacy that we live with every day as an agency. And in 2020, when John Donnelly became fire chief, he was born and raised in Prince George's County, so neighbor of the district, and had come up in the fire department. And so it was a priority of his to really focus on diversity and racial equity and having that dialogue internally. So he had already started several initiatives. We were fortunate to hire Kenneth Hunter in 2020, our diversity program manager, who really hit the ground running and has been a leader on those initiatives. And so when we got the opportunity to be part of the cohort, we just felt that it was a kind of a no-brainer for us. And we were just excited to learn from the process, but also to share with other peer agencies our experience and our strategies.
Thank you, and thank you to Chief Donnelly for his leadership as well. What I heard from your remarks is the understanding and acknowledgement that there were inequities within your department. And I think that is a critical piece, and also the willing to look inward and assess, so that balance between the legacies of both inequities and the legacy of opportunity. With that, I'll open it up to all of three of our government panelists to talk a little bit about what role does your department play in moving the needle on health and racial equity. So whoever would like to tackle that question first.
Well, I can start. I think one of the things that Chief Conte and the department really want to see move the needle is really change how we're bringing people into the department, right? One of the strengths of MPD, much like the fire department, has been that we are a very diverse department, more diverse than most big city law enforcement agencies. And the most diverse part of our agency is actually our cadet program. And that is a pipeline to bring people from the community, youth from the community, into the police department so that our department can look like the community that it polices. And I think, I say this all the time when I'm teaching at the academy, having that representation within the department really inoculates us from some of the other issues larger police departments have seen in other parts of the country. It doesn't completely make us immune from those problems, right? We still need to look at what we can do better. But I think the fact that we represent the community is something that is good, but we need to continue to move the needle on that and represent the community. And I think programs like the Cadet Corps and some of the outreach programs that we do, where we're bringing in community members that otherwise may not have the opportunities, creates a situation where not only can they be part of our department, but they can help raise the health and well-being of their families, because then this is a job in which they can both attend school and make some money and help the people in their community and their families who may be struggling at this time and may not have health insurance or health care that they need. So I think that's an important part for us.
Thank you. Commissioner Woods or Ms. Mauro?
And I'll just add, for us, one of the ways in which several ways in which we move the needle on health equity and also racial equity is through advancing the values, DC values. The mayor talks a lot about DC values, and ways in which we advance those values is through our diversity, equity, and inclusion initiative. As a financial regulator, we in the department are responsible for regulating the financial services entities here in the district. That includes insurance, securities, and banking. We also are responsible for ensuring that we provide residents with the resources and support that they need to have a healthy financial future. So financial wellness is very much a part of the work that we do. And so we continue to promote the importance of ensuring that there is inclusive and equitable access to financial resources and services. We use every tool at our disposal which includes reviewing our existing regulations, our rules and laws, and considering new local legislative actions, policies, and programs to help promote access to the insurance, securities, and banking industries. We have a number of initiatives that we further strengthened during the pandemic because we recognize that a number of families were suffering as a result of the pandemic due to a number of different factors, including job loss. And so we wanted to make sure that we were being very intentional about how we engage residents around a number of services, managing their finances. We have a whole Financially Fit DC initiative where you can go online and identify what areas of your finances that you want to strengthen, including managing budgets, strengthening your credit, etc. We also have a Bank on DC program that's geared towards the unbanked and underbanked here in the district. We also have one of our newer programs that we're very excited about is our Opportunity Accounts program, which is a match savings program for residents, particularly to help them increase their financial savings. We know that there is a direct correlation between one's health, their physical health, and their financial health. And so we recognize the importance of making sure that we work with residents to help to develop their finances, manage their finances, and address all issues that they may have with their finances. We also launched a new program, our Financial Navigator program, during the pandemic for residents to call in to an actual phone number and speak with the representative to help them navigate and or respond to any questions that they may have about their finances. And so those are some of the ways in which we're removing barriers. We also support the idea that health equity is achieved when every person has an opportunity to attain his or her full health potential. And so we're using a number of tools to help remove barriers that limit access to quality health care. So for us, that is very much a central component of what we do. And then lastly, I'll add that we're a part of a number of national conversations that are happening right now about racial inequities in the financial services industry. I participate on two National Association of Insurance Commissioners special committees on race and insurance on their work streams, where we're fully examining and determining which practices or barriers exist within the insurance sector that potentially underrepresented people of color have challenges accessing. And so that's something is very much a part of the ongoing conversation that's happening at the national level amongst many of my counterparts throughout the United States.
Exciting work going on at the Department of Insurance, Securities, and Banking. You hit on a few things that I wanted to highlight before I pass it to Ms. Mauro. You talked about being intentional about engaging residents and engaging community. I think that's a key piece to applying a racial equity and a racial justice lens. You also talked about reviewing existing policies, which remind me of what Temi said about part of this work is redressing past harms, and what Daniel Dawes said earlier, we can't return to normal. And you mentioned another point about the connection between financial health and physical health, which is one of the themes of this conference, of looking at those social and structural drivers to health. So with that, Ms. Mauro, I'll pass it to you.
Oh, thank you. So the fire department is actually one of the largest providers of healthcare in the district. We respond to over 150,000 emergency medical services calls per year. And improving the compassion and competence of our EMS care is a top priority of the agency and also of Mayor Bowser. And because our patients are disproportionately racial minorities, any effort that we have to improve care across the board should benefit those patients. We're also aware of the disparate health outcomes of racial minorities, and an example of that in the district is that 82% of our cardiac arrest cases, the patients are African American, but their survival rate is only 50% that of our white patients. Another sobering statistic, we did an analysis in 2018 and found that while 39% of cardiac arrests occur in wards 7 and 8, only 3.7% of the city's AEDs at the time were in those neighborhoods. So we have a pretty robust citizen CPR effort. We disproportionately offer that training in Ward 7 and 8, and we also have partnered with MPD to increase the number of AEDs that their squad cars carry. And so MPD has been sort of a force multiplier in delivering health care in those life-threatening cases east of the river. So in addition to improving the quality of care that we provide, we also consider ourselves a partner in equitable access to health care. And an example of that is our city has a culture and a history of using EMS for primary care when going to the emergency department isn't going to provide patients with that highest level of care or necessarily with the care that they need. And so for that reason, we started the Right Care Right Now nurse triage line in 2018. And the goal of that is to divert non-emergency patients away from 911, away from emergency departments, and into a primary care setting, so that those patients can get the right health care home and hopefully improve their health and their health outcomes overall. So those are some examples of how we're trying to participate in that work.
And thank you for sharing that data. When we talk about applying a racial equity lens or racial equity methodology, it starts with understanding what the data is telling us. So you all looked at the data to determine a different course of action and to address some of the inequities that you all observed. So we're going to shift gears a little bit. A theme of this conference the summit has been around community engagement, the importance of listening to communities. Daniel Dawes talked about, the same communities that are closest to the pain are also closest to the solutions. And those communities also have strengths and assets that should be listened to and incorporated into our decision making as government leaders. So I'd like to hear from our government partners. Also like to hear from Temi as well on the philanthropic side, because you mentioned how you were really listening to community to design sort of your funding portfolio. So what are you all hearing from community stakeholders as the top racial equity priorities, and how does that align with the priorities of your department? So I'll open it up to all of the panelists.
So our stakeholders are both internal and external, as the captain mentioned earlier. We have hundreds of positive interactions with our customers every day, but sometimes we fall short. And the most common complaint that we get is on an EMS call, you didn't treat me with compassion. It didn't feel like they were listening. It didn't feel like they appreciated the urgency of my concern. And so when we look at those, we're really very focused on incorporating that into our training, and not just sort of the basics of how to deliver good customer service, but we also are ramping up our implicit bias training in the agency. So we'll look at a call and we'll say, why did you treat Mr. Jones that way? Why did you make assumptions about the urgency of his care? Is that something you would assume in every neighborhood in the district, or did you have these sort of innate biases in one direction? And even if not intentional, of course, as we know, it's something that we need to help our employees identify and try to eliminate. And so we started this year with what we called Leading with Awareness training, and we provided it to our executive staff and all of our chief officers. And it was, we got a lot of positive feedback, and the number one recommendation was to really push that down throughout the organization. So one of our department's strategic initiatives this year is to provide that training to 50% of our workforce this year, and then 50% the following year. So those are our external stakeholders. Internally, I mentioned earlier, we do a good job of having diversity in our entry-level recruit classes, but we get less diverse as we go up the supervisory chain. So we have a competitive exam promotional process for our workforce to become sergeants, lieutenants, and captains. And we hire a vendor to give an objective test and to eliminate bias in the test. But this year, Chief Donnelly wanted to have some department-sponsored workshops open to all employees to give advice on how to prepare for the exams. The tradition of our department and the fire service culture is to prepare for exams relying on social networks, study groups, etc. And so whenever you have a system like that, there's the potential for advantage to be passed down, right? So our goal with these workshops is to level the playing field and hopefully continue to diversify our supervisory chain, which can only improve the department as a whole. I think we would all agree, so.
Thank you.
Yeah, I think from the police department's perspective, I think your question raised a really important point, right? Part of moving the needle isn't us telling the community how to move the needle or us deciding how to move the needle. I think a really important part, we talked about intentionality, but we also talked about, and I'm sure Temi's going to touch on it as well, listening to the community, right? For far too long, the police department has kind of been this force that comes into a community and decides how to enforcement, what kind of interactions need to happen with the community. And I think a big part of that, and one of the things that we're trying to address that, is things like chat with the chief, where Chief Conte actually gets onto a forum just like this, virtual forum, talks to community members, talks to advocates, talks to people involved in social justice, and listens. And we listen all the way down from the resident all the way up to fellow partners in DC government, as well as philanthropic groups as well. And I think that's a really important part when we're formulating our response to racial inequalities, because if we just decide, it's never going to fit the community right. And that's the most important part, I think, for a well-functioning police department to fit in to the DC community, to the different neighborhoods, because a response in Ward 7 is going to be very different than a response in Ward 2. Just for those facts that Ms. Mauro gave before about the health inequities from ward to ward. So I think that's a really big, important part for us at the police department is sometimes we stop talking and we need to listen a little bit more. Absolutely.
Stop talking and listen. Thank you for that.
Yeah.
Woods, Temi.
Oh,
Go ahead.
Sure. I was just going to say that, yes, we believe that lived experience is subject matter expertise. So we always want to be in thought partnership with community. But as far as priorities, I think we just need to acknowledge that, at the end of the day, racial equity is about shifting resources. You're talking about communities that were divested from for centuries, right? And so we're talking about, Amy, you were talking about the inequities east of the river, but the inequities are there because it was Black folks east of the river, right? And so unless we address all of those systems that are affecting those people east of the river, then we're not doing equity work, right? And I think I couldn't tell you a priority because they're all a priority. Any social determinant of health is a priority for the folks east of the river, right? Or any inequitable community in our region or the city.
And that's a really important point. When Dr. Arno and I were collaborating on this idea, looking at the impact of structural racism as a driver of health inequities, and we talk about structural racism, we're talking about how different systems reinforce each other. What happens in one sector will impact what happens in another sector. And I think a theme that has come out of this summit is that, we can't operate in silos. It's easy to do that in government. We must partner with philanthropic organizations and community-based organizations. So thank you for that insight. Commissioner Woods?
This, and I agree with all of my fellow panelists and the comments that have been shared thus far. And I would just add that there are many different areas that are a priority as it relates to advancing and addressing racial inequities throughout our community. And so for us, one of the continuous things that we've heard based on conversations with community stakeholders is the importance and the need to advance pathways and access for the next generation of financial services professionals. And so we have spent a lot of time internally really thinking about how do we do our part as professionals, as regulators, but also as regulators that have access to external resources to further advance the next generation to getting their foot in the door in the financial services industry. And so in the summer of this year, 2021, we expanded our Financial Services Academy. It's a public-private partnership between our department and local education institutions and private companies that are really focused on introducing and exposing high school and college students, particularly those from underrepresented communities, to the financial service sector with the goal of really building a pathway to a career. We have been effective in hosting. We piloted through the Summer Youth Employment Program last summer. We piloted a new program where we hosted a number of students in our Insurance and Securities Bureau. These are paid internships, thankfully, through the Summer Youth Employment Program, so we're able to offer them paid internships to learn more about the insurance and security sector. We've also recently announced a partnership that we entered into with George Washington University through their School of Business to, again, introduce more students to the financial services sector. We're in the process of finalizing an MOU with Gallaudet University to do the same. We've been in conversations with Howard University as well. They've had a long-standing insurance program, and so looking forward to also working with them to bring them into the work that we're doing and also do our part. We know that the financial services industry is very important to the work that we do, but also to our lives day in and day out. And we want to make sure that more young people have access to that industry, understand that industry, and enter into it, particularly for full careers. I mean, here at the department, we have staff that have been with us 20, 30, 40 years, and they started out early on in their career and have found a lot of success in the financial services industry. And so that's one of the ways in which we are really addressing some of the needs in which we've heard from community stakeholders.
Thank you. And I think our audience were able to see a snapshot. We have a graphic reporter who's with us. I think you may have seen a snapshot. Also, if you are watching, if you have questions for the panelists, feel free to put those in the chat. We'll save time at the end. But when I saw the snapshot, they zoomed in, Temi, on a few things that you said around, equity and justice are distinct, and that racial equity is about shifting resources. And I want to also just level set a little bit about how we're defining racial equity. So we talk about racial equity, we're talking about it as both a process and an outcome. So as an outcome, we know that we will have achieved racial equity when race will no longer predict outcomes, opportunities, or the distribution of resources, which really zooms in is that racial equity is about shifting those resources and shifting power. And as a process, it means that we're meaningfully involving those who are most impacted by structural racism in the creation of policies and practices that impact their daily lives. So with that, I'm going to open it up to our final question to the panelists. Hopefully we have some questions in the chat box, and acknowledging that we're on a roadmap. This is about agenda setting and looking into the future. So I want to ask each panelist, what lessons has your organization learned? Or what are some policy and practice changes that have been made in the past year, or things that you're looking forward to in addressing racial equity? So I'll open it up to all of the panelists.
I'll go first. Sure. What we realize as an organization is that even though we have a Black woman at the helm and all of our staff are BIPOC folks, we still operate in white supremacy, white dominant culture. And so we've been interrogating that for the past few years, but then COVID really made us crystallize on particularly characteristics of like overproductivity and hyper and urgency, right? And so we have like an away message that I sent that people get that says that we are interrogating urgency, and you'll get an email from me. It doesn't mean that you're not going to get it. You might not get it right away. It doesn't mean that I haven't gotten it and it's not important. But urgency and hyperproductivity is a problem in our culture, in our work culture, particularly in America. But then also we've taken organizational pauses. And so we've taken a week off where we're closed and internally we're in community with each other, or we're just resting. We've adopted the nap ministry. If you want to take a nap throughout the day, you can take a nap and nobody's going to have a problem with that. And so these are just some of the things that we've just really wanted to pivot, because yes, we're working from home, but then sometimes that gets people feel like you're always available. And so really trying to put up barriers and making sure people are getting what they need and are rested.
And I have seen your away message, Temi, in one of the tables that the IF Foundation convenes. They hold sessions on healing justice, and I'm
Yes.
still learning that practice. So I appreciate you introducing that to us. What about other panelists? Thoughts on things that you're looking forward to, policy and practice changes related to addressing racial equity?
Well, I can talk about policies and also lessons we've learned as we go down this road. Most of our policy focus has been on recruiting. So we decided to be much more, we've always had a pretty rigid vetting process to come into the fire department as a paramilitary agency. But we decided in recent years to really double down on making sure our candidates embrace the core values of the department and of the district. And we do that by, of course, an interview process, but also looking at social media and making sure that we have candidates coming in who are going to treat our patients and our customers with respect and compassion. We're also working on expanding our cadet program, which the police department has as well, and that's a program that recruits DC residents to be firefighters, and historically has been very important to our agency, and we decided we wanted to, and they also become very loyal and good employees, and so we decided we wanted to expand those numbers. We're looking also at trying to increase the number of homegrown paramedics that we hire. Typically, we compete nationally for paramedics. It's a hard to fill position. So we would like to create a process for giving our own employees and residents the skills to become paramedics successfully. In terms of lessons, over the last 12 months, the department has held 2 town halls on race and diversity. And we've certainly learned a lot during those conversations. One which makes me laugh is we've been told by some vocal employees that our executive team is old and full of senior managers, and we need to, I don't consider myself old, but you have to hear that. And so we need to include younger generations in these conversations. And so we created a diversity advisory council, and we're mindful to try to include people of all ranks in the agency with that, and to let that council feel empowered and involved in the conversation, right? We've been talking about that a lot today. So also working on getting employees comfortable talking about these topics. I think in a paramilitary atmosphere, the assumption has always been that you can't talk about race or politics or class because it's only going to create conflict. Where actually we've started to embrace the opposite, which is if you learn the skills of talking about that, then you're going to have less conflict among your teams, you're going to work better together, and you're obviously going to serve our community better. So that is another lesson that we've learned.
And Amy, your last point touches on our theory of change in the district for this work. So having the conversation. So part of our theory of change is normalizing conversations on race, racial equity, what it is, what it isn't, and developing a standardized and shared vocabulary. So that's an important part. And then we build upon that by organizing, building capacity, operationalizing racial equity through the development of tools, and then assessment. So we're in the process now of coming up with our measurement and data strategy and coming up with key performance indicators so we can hold ourselves accountable. Captain, Commissioner, thoughts on our question of lessons learned or things you're looking forward to related to policy and practice?
Absolutely, and I would concur. You said early on that racial equity is a process and an outcome, and I would say that that has been one of the main lessons that we've learned, that this is work that is a process, and hopefully that process leads to a long-standing outcome. So one of the other lessons that we've learned over the past year is the importance of engaging with our industry stakeholders early and often. We have to, we believe in the practice of leaning on the expertise of industry stakeholders, including consumer advocates, to help guide our thinking and direction around the work. And so for us, that has been a practice change where we engage them early on and throughout the process to help shape our thinking. Our stakeholders also serve as a resource by providing data analysis. For us, it's important that our work is informed by data. And so working with our stakeholders to provide data analysis to help further support any type of policy and or program decision. I will say we don't always agree with our industry stakeholders. However, their input is very much important to the work that we do towards addressing racial equity. We've also leaned greatly on what we've learned greatly has been the need for the type of services that my department provides. COVID really did expose a number of the vulnerabilities and inequities within our residents. And so we had to really retool, fine tune, and rethink the way in which we deliver services and fulfill our mission, particularly as it relates to serving the overall financial needs of our residents. And so those are some of the lessons that we've learned and the practice changes that we've made internally. I'll also add briefly that at the department, as I mentioned, we have a diversity, equity, and inclusion initiative. That initiative has been guided by two working groups, our internal working group that consists of staff across all of our bureaus and divisions, in addition to an external working group that consists of stakeholders, external stakeholders. And so it's been through both groups that we have developed a set of recommendations as it relates to our internal operations and how we apply the lens of diversity, equity, and inclusion, and also as it relates to our external engagements in terms of how we regulate the financial services industry. And so that very much has also been a part of our effort to address racial equity overall.
Thank you. Thank you. And a theme from your remarks, Commissioner, and throughout the summit, I've said this before, is on meaningful community engagement. And you talked about that engagement should be early and ongoing. And I think that's critical. For example, we're going into communities, tapping into their wisdom. Okay, where is the follow through? How are we communicating the proposal or initiative and the development there? So thank you for that. Captain, lessons learned, things MPD is looking forward to?
Yeah, I mean, I love this graphic illustration. It's great. I think the one I want to pick up on there is it's both a process and an outcome. And I want to touch on, racial equality and diversity within MPD is vital. I've said that a couple of times about making sure we represent the community, but we don't want to just stop with racial diversity, right? And I think one of the lessons that we learned from the last year when we started seeing all the stuff that happened since last summer is that we can't just stop with racial diversity. And I think that's what the lesson that we really learned. We're doing things like joining the 30 by 30 challenge, which is 30% of women in law enforcement by the year 2030. We're joining, I think, over 100 other law enforcement agencies to join that call for an increased representation of not only underrepresented racial minorities, but also gender minorities within law enforcement. I think that's really the most important thing personally, and I think as a department that we're taking away, is that we have to continue that diversity across the board. And I think racial equality is the foundation that we can build on a more diverse and inclusive future within the department and how we interact with the communities outside the department. Building on those, and then, just to touch on what you mentioned is training. I think you can't change the department just on recruiting alone, because you have a backup of, especially with the fire department and police department, our employees tend to stay with us for 20, 25 years. So it's really a hurdle to train in these differences, whereas some workforces, you see a higher turnover, people move on to different agencies, different private sector jobs. But we have people who start with us and we're the only job they've ever had. So if we don't give them that training, the tools to discuss racial inequality, gender inequality, sexual minorities, transgender rights, then they don't have those capacities. So we really have a special duty, I think, to start those conversations within the department with bias training, with education on the different community groups, even down to one of the classes we're doing this year in our professional development training, which we do yearly, is discretion. Talking about the use of discretion in law enforcement as not a tool of letting somebody off the hook, but interacting with the community and giving right-sized justice for that community. And I think that's a really important part of it. So really, I see it, this is a foundation for us to continue the work, which is, like we said, is a process, definitely.
And thank you for mentioning gender. It's a big priority of our agency as well.
Yes, and I was going to comment on that we're being intentional and leading with race, but one of our guiding principles is to also do this work through an intersectional lens, so that's critical. So I want to see if we have some questions from the audience. I'm not sure if we can show them on the screen, but I think we have one that came in. What steps have you taken to address issues for those who are, this is also getting at intersectionality, so what steps have you taken to address issues for those who are people of color and seniors and or those with physical, mental, learning disabilities, as well as residents in the workplace? So you mentioned, Amy, that you all are focusing on gender as well, so I think this question is getting at how are you looking at the intersections of race when it comes to people living with disabilities and our seniors. Any thoughts on that question?
So for us, a big thing for us was language justice this year. And so like our website, we have a board member who speaks Spanish and it's only as a first language. And so we have interpretation at all of our meetings, anything that we do publicly, we have interpretation. Our website is in Spanish. Our website is ADA, I don't know what you call it, capable, right, for folks with disabilities. And so for us, it's an ongoing, it's an iterative process that we're always trying to check. And so when issues come up, we try to address them in the moment, especially when it comes to we want to center all folks and let them show up fully as themselves.
No, and thank you for bringing in language access.
So we, when people call our department, they're frequently calling because they have no other supports. And so we have a lot of senior citizens and disabled people who fall into that category. And so when we're there, we want to help, and we don't want to just help in the moment on that incident scene, but we want to refer them to our government partners to try to give them more services so that they feel more supported and don't need to necessarily call us or rely on us in the future. Also, seniors are very vulnerable when it comes to fire safety. A significant percentage of our fire fatalities this year have been residents over the age of 50. So our fire prevention and public education program is very focused on doing outreach with the Department on Aging and going to senior citizen facilities and apartment complexes to educate them on basics about fire safety within the home, kitchen safety, etc. So I would say those are the populations where we focus on how we can do strong public education and also connecting them to the broader resources available in the district.
Yeah, and just like the fire department, the police department, obviously, we're 9 times out of 10, 3 o'clock on a Sunday morning, if somebody's in crisis, we're calling the fire department and the police department. So we found that, we really have to equip our responding officers with the ability to deal with people with a wide variety of abilities, disabilities, ages, mental capacities, and possibly even mental health crisis. And I think, partnering, and I think one of the lessons, as we were talking about earlier, that we've learned over the last year and I think longer is that even though we can train into an officer, crisis intervention officers, one of the flagship programs that we have for mental health crisis, partnering with agencies that are better equipped to handle those calls is really vital to a robust whole of government response. And I think that's really been the important part for us, right? We may be the initial responders, but we need to be that conduit that if somebody is calling at 3 o'clock in the morning because they're a senior citizen and they're experiencing some sort of health crisis or mental health crisis or even like a financial crisis, that we're there and we know where to connect that person to. I think that's a really important part. And I think that's one of the strengths of the police department. Sometimes we try to wear a lot of hats and some of those hats don't fit us very well. So I think it's really important for us to be a strong advocate to connect them to other resources, whether it's nonprofit, non-governmental, or if it's within the DC government.
We just, Commissioner Woods, any final thoughts from you before we wrap?
Been very intentional about our partnerships across the board. We work very closely with DC Office of Aging. We're a part of the Age-Friendly DC Task Force. Our consumer advocate has partnerships with a number of senior community centers and provides workshops and sessions for residents about their finances, how to protect themselves. We know that seniors are quite vulnerable and oftentimes victims of scams. And so we work extensively with them throughout the year. We also, as I've mentioned, are in direct partnership with Gallaudet University. We have been historically in partnership with them through their risk management program, and we're looking to develop a more formal MOU with them to bring more of their students into the work that we do. I'll also add that we partner with just about every agency you can imagine within district government, particularly the Office of Disability Rights, the Mayor's Office of Women Policy Initiative, the Mayor's Office of LGBTQA. So all of these agencies we're working closely with to ensure that we're reaching the populations and informing them about the services that we offer. We also are very intentional about providing information to residents about consumer scams, because there are a lot of scams out there. And so we issue a number of consumer alerts to inform residents about a number of scams that our enforcement and investigative unit are identifying.
Thank you. And unfortunately, we are at time. I want to thank Commissioner Woods, Captain Hrebenak, Ms. Mauro, Ms. Bennett for your time, for your insights. I definitely learned a lot, excited about the work that we will do, continue to do in district government, excited about the work of the IF Foundation and the work that you're doing with community advocates to hold us accountable. So with that, you can expect to see updates on the DC Health YouTube page, where the concurrent session moderated by my colleague, Dr. Arno, will be posted, along with all of today's discussion. So after a 5-minute break, we will return to reflect on key insights from this inaugural Health Equity Summit and prepare for the work that we all must do to advance health and racial equity in the district. So stay tuned.